Hi, welcome to today's session. Today's topic is the surgical patient, a clinical assessment. This talk is directed to medical students who are coming to surgery for the very first time. These are simple and basic guidelines for them how to clerk the patients in surgery to come to a clinical diagnosis that is precise and acceptable. Initial and essential part of dealing with the patient is the clerking of the patient. Clerking a patient is the first and the most important contact that any medical student has with the patient. The main purpose of this clerking is to obtain a detailed history of his symptoms and perform a physical examination to collect the signs that he may have. With these symptoms and signs collected, the student can come to a reasonable and logical diagnosis and a couple of differential diagnoses. A right attitude is of utmost importance when dealing with patients. The right attitude to yourself. Initially, there will be some fear and anxiety encountering a patient, but you need confidence and the right attitude and effort on your part to overcome this fear and anxiety. Right attitude towards the patient is also very important. Okay, you must always have an attitude of courteous, concerned, and compassionate, the 3 C's. These are very important to gain the confidence and cooperation of the patient in the long run. The patient may react abnormally towards you not because they're in bad intention, but because of their own fear, anxiety, and uncertainty of what is going to happen. As we know, they are all humans with deep emotions and feelings like each and every one of us. There are some unwritten rules to adhere to when dealing with your patient. First, the patient is right as far as his illness is concerned. The patient knows his illness best. Treat this information with utmost confidentiality. Always respect his decision on treatment. Treat always, cure sometimes, but never cause harm. The learning process in medicine is a lifelong one. It gets better with time and experience. The adage, the more patients you clerk, the better your skills in diagnosis, is very true. Now we come to common symptoms in surgery. In the history, the most common symptom of a surgical patient is pain. In fact, more than 90% of patients will come with some sort of pain somewhere, and that is what brings them to see the doctor and the hospital. It is very important, therefore, for us to find out every detail about this pain, to analyze its source and origin. The onset of the pain, the site of the pain, the duration of the pain, the progress of the pain, whether it is becoming increasingly worse or becoming better, radiation of the pain from one side to another, the severity of the pain, mild, moderate, or severe, the aggravating and the relieving factors of the pain. So these are very important parameters that as students of surgery, you must very carefully get from the patient. The next symptom the patient comes with is a lump, a mass or swelling somewhere. Again, this is a very common symptom, and more details of this lump or mass should be obtained. The onset, the site of the lump or mass, duration of the mass, how long it has been there, is it growing or is it stopped growing, diffuse or localized, whether there is edema and skin changes, and equally important is the mobility of this lump. Lumps or masses in the abdomen is of special importance to surgical students because the site and size is very important, because to localize the lump in a certain anatomical location will be important to know where or from which organ the mass arises. Next, bleeding. There are 4 important bleeding problems in surgery: vomiting of blood or hematemesis, passing of black stools, stale blood in the stools or melena, blood in the urine or hematuria, and blood per rectum or hematochezia. These are the 4 important or common bleeding sites in general surgery. It is important for us to find out from the patient the amount of blood loss, the color of the blood that is being lost, presence or absence of clots, and very important, whether associated with pain. Ulcer, sinus, and fistula. These are rarer causes presenting symptoms of patients compared to pain and the first 3. Again, the site, size, the ages of the ulcer, the base of the ulcer, the surrounding skin changes. These are all important parameters that we must try to obtain from the patient. The next 3, discharge, fever, nausea, and vomiting, are also important, but they are less specific and do not give us any clue as to the source of the cause of the problem. As for the nausea and vomiting, it is very important to find out the color, contents, projectile or otherwise, the frequency of vomiting or the severity of the vomiting. As for the fever, it is important to know nature of the fever and the associated chills and rigors, because certain conditions give chills and rigors more than the others. Whatever the symptom is, the 7 categories of symptoms which I mentioned, you must always find out the 3 important things: the duration of the symptom, the onset of the symptom, and the progress of the symptom. Okay, these are very important. Okay, this diagram is a very important diagram known as the quadrants of the abdomen and the differential diagnosis of abdominal pain. As I told you, abdominal pain is a very common symptom, and it is very important for the students to find out the actual site of the pain in the abdomen. Okay, these are the 9 so-called regions or quadrants that classified according to the site of pain. Okay, so it is very important for you to find out exactly where the pain is. Now we come to common signs in surgery. Again, in surgery, lump, mass or swelling is the most important sign that we will notice in patients. Next, tenderness. This is pain on pressing or touching or applying pressure to the place where the patient complains of pain. In the abdomen, you have to localize the tenderness to one of the quadrants which was mentioned earlier. Jaundice, color of the sclera is a very important place to look for jaundice. Pallor, again, it can be easily noted in the conjunctiva. Guarding, rigidity, muscle rigidity on palpating the abdomen. So tenderness and guarding go together. Okay, and it's very important to localize which abdominal segment the maximum tenderness and pain are. Loss of function with pain, example in the leg, swelling of the leg, unable to function, use the leg, so that is loss of function. Edema over the legs and ascites in the abdomen are another important signs that are seen on and off in our surgical patients. Next, the nutritional status, wasting, emaciated, cachectic, and massive loss of weight. These are important signs to look for in surgery patients. Next, we come to the format for the clerking of a surgical case, which is similar to clerking of patients from different disciplines. Not much different. First, the history. In the history, you look for the identifying data. This is very important, especially in the chief complaint. The age is the patient is of very, very important. Next is the sex and ethnicity, less important. Chief complaints of the patient, very important. If there's more than one, then you must give them in chronological order, according to which came first. Okay, the chief complaint is a very important thing, something which is at times very difficult to get from the patient. So you must be very careful to find out what is the chief complaint that really brought the patient to the hospital. Next, history of present illness or HOPI. Again, go into the details of the chief complaint and all other complaints that the patient may have in chronological order as well. Then look for the relevant associated positive and negative symptoms. Not only positive symptoms are important, but the relevant negative symptoms are equally important. Then you have a complete review, systemic review from head to toe, all the systems, asking for complaints in every system in the body. And ONG obstetrics and gynae history whenever necessary. Past history is very important, past medical history, but as far as in surgery, the very important is surgical history. You must know the details of the surgery done, if possible. When was it done? Any complication that was encountered? Okay, so these are very, very important. Drug history, of course, we want to know what's the drug history, like in all other disciplines. In surgery, we are particularly more interested to know in abdominal pain whether the patient is taking drugs that can aggravate the abdominal pain. Family history, certain cancers like colon and breast cancers tend to run in families. And lastly, nutritional, diet, social and occupational history. Anything that is of particular importance and relevant to the chief complaint of the patient. Next, we come to physical examination. First is the general inspection, where you look at a patient's general health status, nutritional status, whether he is in pain, whether can he lie down flat, lie down comfortable. These are the important general inspections. Although you can say it's general, but it's very important to give you an idea as to the disease status of the patient. Vital signs are equally important: blood pressure, heart rate, oxygen saturation, and also fever, temperature of the patient. Again, like the symptoms, relevant signs in relation to the chief complaint. Okay, you have to look for relevant positive as well as negative signs in relation to the chief complaint of the patient. Then we come to local or specific examination in relation to the chief complaint. If the chief complaint, for example, is abdominal pain, then the local or specific examination will be an examination of the abdomen. And then followed by a review examination of all the systems, head to toe, to look for any signs that may be relevant to the chief complaint. After the obtaining the physical examination, then we go to the next one is the clinical summary. You want to get a clinical summary, include history and physical examination. The summary should be short and precise in 5 to 6 sentences only. Okay. With this clinical summary, you should be able to arrive at a working diagnosis or provisional diagnosis as we call, which is the most likely diagnosis in this patient based on his or her symptoms and signs. Okay, it's very important. Symptoms and signs must be the base on which your diagnosis is made. Again, the diagnosis that you consider must be prevalent or common conditions that are commonly seen here. With the provisional diagnosis, we also look for at least three possible differential diagnoses. Again, these must also be related or based on the symptoms and signs of the patient. And also it must be a common condition which occurs here. Once we have this provisional diagnosis and differential diagnosis, then we go ahead to plan the investigations for the patient. Investigations can be blood, urine, and imaging techniques. Whatever investigations, it must be least invasive, cost effective, minimal or no complications, no or minimal radiation, and also availability. It must be available in the place where you work. Okay, these are the criteria that you use to choose your investigations for your patient. After the investigations, you come to the definitive or final diagnosis. Okay, after reviewing the results of all the investigations and possibly even with tissue diagnosis or biopsy, then you can come to a definitive diagnosis. Okay, so after the definitive diagnosis comes the management and treatment, which can be immediate treatment and delayed treatment. And after the treatment, then you got to have an outline plan for the patient for the long-term management of this condition. I hope my short talk today will be able to guide you in your new encounters in the surgical ward. Thank you. If you need further information on this topic, please visit my Facebook page as shown in this link. Thank you. See you again in the next session.